At Alexandra Hospital, we are always ready for what the day has to hand us. Under our FAST program, our 24/7 walk-in urgent care center looks at providing emergency medical treatment for all patients. Here, our experienced multidisciplinary care team is always ready to care for patients with non-life-threatening illness. Nurses like myself are integral members to the care team that provides a one-stop service on consultation, diagnosis, and treatment. We assume a wide range of clinical and patient care responsibilities in assessing the patient treatment plan.
Hi, my name is Juliana. I'm a nurse manager of Urgent Care Center at Alexandra Hospital. As an AH nurse, I hold two roles, and I'm also a lead nurse for infection control. As an AH-UCC nurse, I attend to patients with serious but non-life-threatening conditions. When patients arrive in UCC, I prioritize them based on their clinical conditions. I also manage their family members and ensure that they are updated promptly. I work together with our other healthcare team members and ensure our patients have their proper care and treatment. When patients first arrive in UCC, they will usually feel anxious, in pain, and can be confused. So I will usually engage in small talks with them and let them know what to expect during their journey in UCC. Besides giving patients their medications and performing the treatments that's being ordered by the doctors, we of course have to attend to their basic needs, such as giving out blankets when they are feeling cold in UCC. I chose to be a UCC nurse because I enjoy working in a fast-paced working environment and because I will have the opportunity to see all sorts of cases coming to our doorstep. As an emergency nurse, we should be able to think fast on our feet because certain of our decisions can make a difference to a life and death situation. After patients has been triaged and seen by the doctors, patient can either be warded to the general wards. Depending on the condition of the patient, patients may go to intensive care unit. If patient requires some surgical treatments, patient can be directed to operating theatre.
Patients who require complex care have access to our comprehensive suites of medical services, including surgical procedures and allied health services. At AH, our 6 operating rooms are designed to provide seamless transfer and care for our patients. Here, the facilities are designed to create a comfortable and secure environment where both minor and major surgical operations can be safely performed. An AH-OT nurse has the important role of ensuring the safety, effective, and efficient care of the patient in the operating room and after surgeries. Hi, my name is Adeline Ang. I'm an assistant nurse clinician in the major operating theatre in Alexandra Hospital. In the OT, we assist the doctor, making sure the patient is comfortable before, during, and after surgery. We ensure that all the equipments and items and supplies are available before the surgery, and we also assist the doctor during the surgery and ensure that everything runs smoothly during surgery. After the surgery is over, we recover the patient in the recovery area, and for those outpatient surgery, we ensure that we give all the post-operative orders and make the patient comfortable before we discharge the patient. In Alexandra Hospital, in the major operating theatre, we assist in different types of surgeries such as general surgeries, orthopedic surgeries, ENT surgeries, eye surgeries, and vascular surgeries as well. In the OT, we have different roles: the scrub nurse and the AU nurse. The scrub nurse assists the doctor in the surgery field, while the AU nurse assists anesthesia doctor in putting the patient to sleep and recover the patient after the surgery. So there are many types of challenges, but one of the main challenges is every doctors have different type of preference, and we have to try to cater to their preference so that the surgery goes smoothly. Over the years, I have learned how to anticipate during difficult surgeries and learn how to communicate with doctors so that every surgery will go smoothly. I choose to be operating theatre nurse is because I like to be in a challenging situation. I still remember my first case was a Whipple case 14 years ago, where it was a challenging case, and I stayed on to be a nurse in the operating theatre because I like to challenge myself and help in the patient's recovery journey.
AHICU places top priority on patient-focused care for critically ill patients. Our ICUs offer quality care for patients who require intensive monitoring, nursing care, and complex respiratory support. ICU nurses are highly specialized to provide nursing care to patients with life-threatening illnesses or conditions. We provide specialized experience, knowledge, and skills that patients need to survive or to de-escalate care. We are highly trained to provide exceptional care for patients who depend on 24/7 nursing care. I'm Chai Xin Mian, a staff nurse from Alexandra Hospital ICU. ICU nurses monitor the patient closely and flag out any changes in the patient's vital sign so that something can be done before the patient deteriorates further. As an ICU nurse, I need to be courageous because we deal with the sickest patient. We also need to have an eye for details to pick up the changes in the patient's condition. Patients in ICU usually require the use of complex medical equipment. This could include invasive or non-invasive ventilators. At times, patients require special equipment for close monitoring also. I still remember my first ICU patient who was a teenager admitted for respiratory failure. He was intubated at urgent care center and he was quite sick. His parents were worried about him. We constantly engaged and update them and given them reassurance. Eventually, the patient managed to get well and out from ICU. As an ICU nurse, I sometimes need to be very strict with the patient and not allow them to out of the bed as they are weak and it could worsen their condition. We know that they are uncomfortable, but we have to make sure they are safe. It is challenging when patients are not willing to cooperate with the ICU team. It helps when the team, which include the doctors and the nurses, try to do their part to talk to the patient and convince them what's the importance of the treatment. Over time, I learned to show more empathy and to remain calm under pressure. I also learned how to stay focused and work together as a team in emergency cases. To help me with my job, I attend training, seminar, and courses to build on my knowledge and my skill. My training from our mental toughness course also helped me with my daily work. AH supports the development of our staff on whichever track they are interested in, whether it is management, clinical, or education. As an ICU nurse, you are not just limited to ICU. Skill acquired as an ICU nurse can open the door to many different options in the nursing. The reason I choose to be an ICU nurse because I was able to nurse them when they are very ill and able to see them get well and discharged from ICU, which made me very satisfied in my nursing journey.
Alexandra Hospital currently operates a total of 10 inpatient wards, including 1 intensive care unit and 2 isolation wards, and can serve up to 256 patients in total. In the wards, nurses are part of the team of health professionals involved in the patient's treatment. Hi, I'm Hao Moon Hui. I'm the ward nurse from Alexandra Hospital. As a ward nurse, I take care of patients staying in the wards. Every day, I closely monitor patients to have a good understanding of their condition. With this valuable information, I work with a team of healthcare professionals to treat patients and often act as patient advocates. I provide patients and their families with information to help them understand that their treatment and make informed decisions about their healthcare. I also follow up on the necessary day-to-day patient tasks and help develop their care plans when they are ready to be discharged. People often think that ward nurses only clean patients, while it is a necessary and important aspect of our job to ensure patients' hygiene. It is not all that we do. We lead ward rounds, especially in Alexandra Hospital, and often influence patient care with the knowledge we have of patients' condition and progress. We usually take care of patients with an acute condition, but we do also treat patients with a chronic condition, patients going through rehab, elderly or geriatric patients, or patients needing palliative care. We take a one-bed, one-care team approach with all patients at Alexandra Hospital. As a ward nurse here, I play an important contributory role in the multidisciplinary team approach to patient care. I initiate clinical decision, consolidate management plans, and lead ward rounds. I also take part in weekly nurse-led discussion on patient care and develop discharge goals with the multidisciplinary team. The wards are very busy every day. On the one-to-one level as a ward nurse, I'm very invested in my patients. I know more than just their name, I know their preferences and needs. While this can be mentally tiring, by finding out these details, I know I can make a bigger difference in their patient care. It is also a physically demanding job as I'm required to transfer patients from bed to chair or vice versa. But I'm access to equipment that make this physical aspect less strenuous. I also have the support from the healthcare team and my nursing colleagues to upkeep the nursing standards and deliver my best for patients. I became a nurse because I like taking care of people. I find it very satisfying and fulfilling to see patients get better and go home with a smile on their face. I think passion and attitude are very important in being a nurse. It is what keeps me going, especially when I'm faced with a challenge.
256 beds and over 35 procedures, and at the center of it all, nurses play a major role at Alexandra Hospital.
We are integral to patient-centered quality care and to the healthcare team.
We are the backbone of our healthcare system. We are Alex nurses. Join us for an aspiring career that inspires lives.